Welcome. Today, we're diving into the world of defibrillators, life-saving devices you might have seen in airports, schools, or even shopping malls. But what exactly is a defibrillator? Simply put, it's a special machine designed to restart a person's heart or correct an abnormal heartbeat. When someone's heart suddenly stops or beats in a dangerously irregular way, a defibrillator can deliver a controlled electric shock to help restore a normal rhythm. This technology has revolutionized emergency care and given countless people a second chance at life. Let's explore how these devices work, who can use them, and why they're so important in our daily lives. Now let's talk about the heart, the organ at the center of it all. The heart is responsible for pumping blood and delivering oxygen throughout our bodies. When it stops or beats irregularly, every second counts. That's where defibrillators come in. By focusing on the heart, these devices can quickly intervene during emergencies, making a huge difference in survival rates. Understanding the heart's role helps us appreciate why defibrillators are designed the way they are and why their quick use is so critical. In the next scene, we'll look at the situations when a defibrillator is needed most. When should a defibrillator be used? It's not for everyday aches or minor injuries. Defibrillators are crucial when someone's heart stops beating or starts beating in a way that can't support life, like during sudden cardiac arrest. In these moments, the person may collapse, lose consciousness, or stop breathing. Immediate action is vital, and that's where having a defibrillator nearby can truly save a life. Recognizing these signs and knowing when to act is the first step in making a difference. Next, let's see what exactly a defibrillator does to help the heart. What does a defibrillator actually do? The answer is simple but powerful. It delivers a controlled dose of electricity to the heart. This electric shock can stop a chaotic heartbeat and give the heart a chance to restart in a normal rhythm. It's like hitting a reset button for the heart. The process is quick, and when done promptly, it can mean the difference between life and death. In the next scene, we'll introduce a special type of defibrillator you might see in public places. You may have noticed small boxes labeled AED in schools, airports, or malls. AED stands for Automated External Defibrillator. These devices are designed for public use and are much simpler than hospital defibrillators. They come with clear instructions, often with voice prompts, so almost anyone can use them in an emergency. AEDs are placed in busy areas to ensure help is always close by. In the next scene, we'll discuss why having defibrillators in public spaces is so important. Defibrillators are more than just machines, they're lifesavers. In a heart emergency, every minute without help reduces the chance of survival. Having defibrillators available in public places means that anyone nearby can step in and help, even before medical professionals arrive. This quick response can double or even triple a person's chances of survival. That's why defibrillators are so important in our communities. Next, let's see who can actually use an AED and how easy it is. You might think only doctors or trained professionals can use a defibrillator, but that's not the case with AEDs. These devices are made for almost anyone to use, thanks to their simple design and clear instructions. Many AEDs even talk you through each step, making it possible for bystanders, teachers, or even teenagers to help in an emergency. This accessibility is a game changer, empowering ordinary people to become heroes in critical moments. Next, we'll look at what you actually do when using a defibrillator. Using a defibrillator is straightforward. Once you open the device, you'll find pads that need to be placed on the person's chest. The AED will analyze the heart's rhythm and tell you if a shock is needed. If so, you simply press the button that delivers the shock, no guesswork involved. The device guides you through every step, making the process as stress-free as possible in a tense situation. In the next scene, we'll explain how the AED knows when to deliver a shock. You might wonder how the AED knows when to deliver a shock. The answer is built-in technology. AEDs automatically check the person's heart rhythm through the pads. If the device detects a dangerous rhythm that can be treated with a shock, it will prompt you to press the button. If not, it will tell you to continue CPR or wait for help. This smart technology ensures that shocks are only given when truly needed, making AEDs both safe and effective. Before we wrap up, let's review the first step you should always take before using a defibrillator. Before you use a defibrillator, always make sure the person is lying safely on the ground. This ensures the shock is delivered properly and keeps everyone safe. Never use a defibrillator if the person is in water or on a metal surface. Once you've checked the scene, follow the AED's instructions step by step. Remember, your quick action and calm response can make all the difference. Thanks for learning about defibrillators. These devices truly empower us all to save lives.